All right, so now that we've talked about the Valsalva, our next quiz is going to be looking at the images, answering the questions, fluid or no fluid, hole or no hole, and then what I want you to think about is if the patient was able to clear their ear, what would it look like? Okay, so think about what would the tympanic membrane do when they gently clear their ear. Y'all ready?
Yeah.
All right, let's do it. All right, gang, well, how'd y'all do?
I think pretty good.
Okay. You did great.
A little bit more difficult, So look, my hope as we progress through this hour is that your initial diagnostic, intuition is going to get sharper and sharper. The techniques I'm going to teach, like the Valsalva, is only going to make you better, but you watch, as we go through these images, you're going to get better and better at first glance diagnosis. All right, so let's get started with our first one here. Kim, what did you think about this first one?
Initially, I would have said hole, but after going over the monomeric aspect of the tympanic membrane, I would say no hole.
Great answer. So this is key, okay? So we have a right ear, okay? The most common place you're going to have a retraction pocket is going to be the posterior superior quadrant, okay? So this is the posterior superior quadrant right here, anterior, inferior, superior, okay? That's the most common place where people that are maybe even prone to cholesteatomas, that's where it's going to retract, okay? So great point, Kim. So this patient probably didn't have a tympanic membrane perforation, okay? But because it's constantly being retracted, what you'll notice is that portion of the tympanic membrane will get thinner from all that pressure, okay? So what I want to do is I want to show you what the Valsalva maneuver looked like for this patient. Let's take a look.
Can we suck in or blow out?
Blow out.
So he's about to blow out. Boom.
That's
Wow.
crazy.
Isn't that cool?
Yeah.
And you can see how much thinner it is. It's like saran wrap. And then watch, he
Good.
sucks
Suck
in.
and then blow out.
Wow.
Good job.
Isn't that cool?
Yeah.
Yeah.
All right, great.
Super cool. And look, patients that are able to clear their ear like that, I'm not super worried about, because they know, they're like, oh, there it goes again. I need to clear it out, and they feel better. I don't always put a tube in these patients, okay? All right, next up, who wants to take this one?